All right, sounds good. You guys ready?
Yeah, we are live.
Okay.
Live now?
Hi everyone, how's it going? I'm Dr. Lou. I'm currently a pediatric dental resident, and shout out to Fresh Dental Shadowing for having me. So I'm just going to tell you guys a little bit about my journey into a pediatric dental residency, and then also a little bit about some tips for the application process. And this is just kind of a brief overview of the topics I'll be discussing, such as education, dental school tips, applying to residency, and residency itself. So in terms of my education, I was part of something called an accelerated 3+3 dental program. So this is something that I applied to out of high school. And so with this program, it's something where if you get accepted into, then into this accelerated program, then you do 3 years of undergrad at the University Pacific campus in Stockton, California. And as long as you maintain a certain GPA and DAT score, that guarantees you an interview at the Dugoni Dental School. And especially for UOP, the Dugoni Dental School, getting an interview is huge. So as long as you do your research and you're very professional, and you definitely show interest, your chance of getting into the dental school is very, very high. So definitely the benefit of this program is if you're in high school and you're very interested in pursuing dentistry, then this pretty much just fast tracks your process. Originally, I was accepted in the 2+3 program. So this is where you do 2 years of undergrad and then you do 3 years of dental school. And for me personally, I wanted to slow down a little bit and spend time in getting a bachelor's degree, because some 2-3s, they get into dental school without a bachelor's degree. So it's definitely a very fast-paced process, and especially what distinguishes University Pacific from other dental schools is typically dental school is 4 years, and then typically people will spend 4 years in undergrad. So this definitely fast tracks your the process if you're interested in pursuing dentistry straight out of high school. And like I mentioned, I did my dental school training at University of Pacific Arthur A. Dugoni School of Dentistry in San Francisco, California. And then currently I am over in Milwaukee, Wisconsin for my pediatric dental residency at the Children's Hospital of Wisconsin. So I'm currently a first-year dental resident. So this is a little bit about the specialty of pediatric dentistry. The ADA, their official definition on their website is pediatric dentistry is an age-defined specialty that provides both primary and comprehensive preventative and therapeutic oral health care for infants and children through adolescence, including those with special healthcare needs. I think a key word within that definition is special healthcare needs, as especially in residency, we deal with a lot of sick kids, and there's a lot of kids who are differently abled and those who have special healthcare needs. So a huge part of what I believe a pediatric residency encompasses is your medical training and learning how to coordinate cases with the other medical teams. Like today, I had this one patient who is currently undergoing chemotherapy. So I had to reach out to my kids' oncology team, the registered nurses, advanced practitioners, and the MDs to really decide what's the safest care moving forward for my patient. And then personally for me, I decided very, very early on of becoming a pediatric dentist. This happened during freshman year of high school. I'm definitely an odd one out, as a lot of people, even in the middle of dental school, they'll decide, or even after a couple of years practicing, they'll decide to pursue pediatrics. So I was kind of an odd one out, just kind of knowing what I wanted to do early on. And then personally for me, why peds? Pretty much what got me into dentistry in the first place was my own pediatric dentist growing up, Dr. Monalares. He was, I would regard as like a role model personally for me. He was just always making me laugh and feeling very proud and accomplished after every single dental appointment. And that definitely influenced me growing up. And then so my mom still remembers, like when I was 5, I would walk up to her and say, "Hey mom, like when I grow up, I want to be I want to be a dentist." That's what I told her. And, at that time she's like, "Oh, it's one of those things where, little boys want to be like a police officer or something." So she never really gave it much thought. But this desire persisted on. And during starting my freshman year of high school, I reached out to my pediatric dentist growing up and asked him if I could shadow at his practice. And he was very warm, receptive, and I started shadowing. And I shadowed from the freshman year of high school during the summers up until the senior year of high school. And alongside, I was also a kindergarten teacher at a Chinese language school. So this really allowed me and exposed me to working with and helping kids, especially little 5-year-olds running around, and then just being involved in various community outreach activities involving children. Just further my desire that I enjoy working with children, and would definitely love doing that in the form of dentistry. And in dental school, I was also involved in our advanced pediatric clinic, and this was additional clinic sessions that we signed up for to treat patients who are a little bit more challenging in terms of behavior and in terms of the technical aspects of the procedures to be done. And so this was reserved for people who are either interested in peds or maybe for those general dentists who want additional pedo experience. And in addition, this is my own personal preference. I don't really like being okay at a lot of things, but not really good at one aspect. I really like being specialized in one aspect and being able to provide the best care possible in that one aspect. So that's why I gravitate more towards specializing. In terms, for me, is perfect with pediatrics, because I enjoy working with children and also really want to be good at one thing, not really spreading myself thin. But this is not to say anything bad about those general dentists out there who are really good at everything, and definitely props to them for being good at endos, implants, and working with children and other things too. And also too, the field of pediatrics, it's never boring. It's always very fast-paced work environment, and I feel like it's a very fulfilling career as well. And definitely, like I mentioned, my pediatric dentist growing up and other mentors I had along the way really inspired me to pursue this path. So now this is just some general dental school tips for just being successful. This doesn't necessarily just apply to those interested in pediatrics, but I would say definitely work hard in both didactics, which is like your biochem, your head and neck anatomy, your physiology, as well as being really good and working hard in sim lab and clinic. As residencies, really pay attention to both how well you do in the classroom as well as with clinically. So make sure you really do well in those. Personally, for me, didactics was never really much of a problem, but I really struggled in sim lab. So I spent a lot of time, working on my weaknesses, which was sim lab and working on my hand skills. Another big thing I would say is seeking a mentor. Throughout all my years at dental school, my mentor was a huge help. He guided me through my problems and helped really me be on track of pursuing a pediatric dental residency, and really just using your faculty and professors as a resource. Sometimes you forget, but a lot of times your faculty are dentists with many years experience, and they have failed many times, so they want to teach you and help you. So definitely use them as a resource, ask them as many questions as possible, and pick their brains out. And another thing personally is I didn't do research, but it is helpful but not mandatory for those who want to specialize, as it can show your continued interest in maybe one aspect. And also, for if you're interested in peds, get to know your pedo department really well, spend some time there and know the people involved there as well. And just being active in volunteering activities with kids, and mission trips are also great as well. I was considering on going to mission trip in Cebu, Philippines, but with COVID and all, they canceled that. But it was kind of a bummer, but I was really looking forward to going on that mission trip. But so hopefully, if COVID doesn't get too bad again, consider mission trips, and finishing requirements early is also huge as well, because when you're in dental school and interviewing, you take a lot of time away from clinics. So it's really important that you're on track for graduating, as you can't start residency if you don't even graduate dental school. And now I will kind of shift the focus in this presentation more towards applications for a pedo residency. So usually the first question that pops up for which program should I apply to is kind of a daunting question, because if you click on the APD website, it just shows all these different programs, and it's really hard to narrow it down. So I like to have a more focused approach in trying to determine which programs are good. So first thing I'll consider is the location of the program. For some people who are maybe married or have significant others, and definitely for them, they're maybe tied down to a location, then they're a little bit more limited to that. But if you don't have those obligations, then definitely I would recommend to really apply everywhere, as there are a lot of great programs, not in the vicinity of your own, dental school or surroundings. Like personally, for me initially, since I was born and raised, went to college and dental school in California, I was really heavily leaning towards going to a residency or picking and ranking one high in California. But then my mentor convinced me otherwise and really opened my eye up to applying to other places. And if you told myself in the beginning of the application process that I'll be ending up in Milwaukee, Wisconsin, I would not believe myself. So definitely apply everywhere if you have the ability to. Stipend and tuition. This is one thing that it shouldn't be the sole determining factor, but definitely with undergrad and dental school, you accumulate a lot of debt. And it definitely isn't fun paying even more tuition in residency. So that's why a lot of programs, they offer a stipend. So typically they're more competitive just because it's a very nice added bonus, pretty much paying to learn, or them paying you to learn versus you paying them to learn. So for me, I considered it a little bit more for the stipend because my dental school was so expensive, so it had a little bit more weight. Also, reputation and residency type. So as you probably know, just from talking to different people, different residencies have also even a different personality in terms of the people who embody it, as well as, the strength. So maybe one residency might have more experience with special needs kids. Maybe another might have a lot of experience with oral sedation or IV sedation. So each residency, I feel has their own little rep. And then residency type, there's different types of residencies in terms of peds. So I'd say there are 3 different types. The first one would be a hospital-based. Second one would be a university-based. And third is called hybrid. So it kind of combines the feel of both the university as well as the hospital-based. So for hospital-based, you see very, very high volumes of patients and typically very medically complex patients as well. University-based, I would say it's associated with the university. So typically research is a little bit more emphasized, as well as more didactic training. But that doesn't say that, with hospital-based, there isn't didactics, which is not true, because there definitely is, lectures as well for hospital-based residency. And also special interest, maybe if you want to pursue a master's or MPH, those are other factors you can use. So definitely use those little bullet points to help you and narrow down the list from the AAPD website. So for the question of how many programs should I apply to, it definitely is different with COVID because when I applied or was interviewing, I would say all my interviews but one were virtual. So the benefits of it being virtual is that you're allowed to apply to way more schools. So I think during one day, I interviewed at 2 places in one day. And this was all possible just because it was different time zones. And so I was able to make it work. But if it were in person, that would be impossible. It would be impossible to interview maybe in let's make it up in Nevada one day, and then in 2 hours flying over to Florida and interviewing there. It just wouldn't be possible with, being in 2 places at once. So I would say the benefit of it being virtual is you're allowed to interview and apply to more places. But if it were in person, you'd definitely give thought in that you have a limited amount of places to go at once. So a good number, I'll say, is around 10 to 20. And depending on, your own personal preferences, you can alter that a little bit. So this right here, just a little screenshot of the Idea Pass website. So this is pretty much the portal that you use to apply to residencies. And so within Idea Pass, there's some information that you need to fill out. So for things such as personal statement and experiences. You can include things such as employments, extracurricular activities like volunteer work, healthcare experiences, research, teaching experiences, dental experiences, whether it be paid or unpaid, and extras kind of jot some ideas down. For achievements, you can write down like awards, like scholarships, honors, any presentations you give, or any publications. And for additional information, you can even write about like description of any foreign language skills. And that can definitely help, if you deal with a very diverse patient pool. In terms of documents, it's really important that you have your CV, resume, all your unofficial undergrad transcripts. So that's really important. Even if you maybe take a summer class at maybe like a community college or different college, it's important that you get that in as well. And just making sure you upload all community college, undergrad, or other college level coursework for your transcripts. And for program materials, it's also really important that not all schools have supplemental questions, but some do, and some have supplemental fees that you have to mail in. So it could be very, very, very organized in knowing exactly which each program they apply to requires. And for the supplemental payments, a lot of times you can find that information on the DIA website, but sometimes you have to dig onto the actual program website itself. So just make sure to be very organized and do research. So there's just some more information that you can fill out. It's pretty self-explanatory. And this right here was what I thought was interesting when I applied. It was a section called the COVID-19 impact. And essentially you wrote down how COVID-19 affected you. So personally for me, it kind of talked about how I wasn't able to do any externships because of COVID, and how the mission trip I wanted to go to was also canceled as well. So you can just kind of feel free to write down how maybe COVID-19 either negatively or maybe positively affected your experience. And this is a little section within the DIA Pass. If you click on the big tab, check status, you can see the status of your transcripts to see if they were arrived, and also seeing your evaluations or your letters of rec to see if your letter writers sent it on time. And again, so applying to residency is not cheap. For the match service, this is separate from the DIA Pass. The match service is similar to what our medical colleagues use. So when med students are applying to their specialties, they match to different specialties. So this is the service they use. So we also use the same service, and it costs $95 to apply. First application is $190, and each additional application is $85. And then supplemental application fees, like I mentioned, not every program has this, but I'll say roughly a third to half of the programs do have it, and they can range from $50 to $100. And as well as your DAT and your national board. I think now it's the integrated board, it's not the part 1 and part 2. And that's around $40 per score report. So from just a loan, this can be expensive, let alone if it were in person, that accounts for your travel fees, for your Ubers, your food, your lodging, and all that. And this really adds up. So make sure you keep track of your finances. And then make sure you also have your market calendars for all the deadlines. Typically, NYU Langone programs have an earlier deadline, which is around August 15th. I would say definitely that do not go by that date, as it's not stated explicitly on the website, but I have a feeling that pediatric residencies are pretty much like rolling admissions. So the earlier the better, early bird gets the worm. Just because as you are sending the applications, a lot of programs are reviewing them and sending out interviews accordingly. So it's definitely beneficial to send it early, but not too early where you might think maybe like your letter of rec or your personal statement or things like that are not the best. You need some more time working on it. So definitely try getting in as early as possible. And I would say in terms of like timeline, maybe late June to early July would be a safe time to be submitting those apps. And this is just like a little checklist that I made that I can use to refer to. And also another point too, definitely helps for when you're asking for those letters of rec to get something very nice, like maybe like a manila envelope, and just put everything into that. So it's very organized for your letter writer. So you can put in like your personal statement, your updated CV, your transcripts, and any other information that you feel like will help your letter writer get to know you differently or more. As if you have it nice and organized, and it's less work on their part in digging all these little files to get to know more about you, as they're doing you, a favor. So you should make it as easy as possible for them. And this is just kind of I know always kind of helps just having some dates in mind. This is what I did, definitely not what you should be, following. It just what worked for me. On May 14th, 2020, that's when Adia passed the portal open. July 26th is when I submitted my apps. Ideally, I would have submitted it early July, late June, but with COVID kind of complicated situations with our spring grades coming out later. My first interview was October 21st. My last interview was December 19th. And then the day I'll never forget, match day was January 19th, 2021. And that's when you found out whether or not you matched and where you matched. And just for some interview tips in general, I think it's pretty self-explanatory. Just being prepared, be on time, and be immersed. Even though it's very simple, a lot of people fail to do that. And another thing I'll say is formulating talking points. So personally for me, I would think about, things that were very important to me. So no matter what questions they ask me, I could, default to maybe talking about these talking points. But of course, making sure that it's on topic and answering a question. But especially when maybe a question might be throwing off guard, just having like these talking points at your ready really helps prevent you, from stumbling and looking unprepared. And especially for Rapido, be prepared for oddball questions. A lot of times they'll ask you very like strange questions. I was even asked to like sing and dance during the interview. So be prepared for anything. That kind of caught me off guard. So just, be calm, be collected, and just be prepared for anything really, even for those oddball questions. Of course, you also have your common questions like tell me about yourself, strengths and weaknesses, and why pediatric dentistry. And a big mistake too is make sure your responses are very to the point and not too long-winded. Like if you end up talking about your whole life story, your interviews start losing interest in what you have to say. And again, a thank you card or email at the very end is very helpful, and getting to really know your program well and researching it is impressive to the interviewers as well. And then here are just some more additional interview tips. One thing that I'll say, especially for in-person, is really making sure that you're conscious of your behavior even during socials. So the thing about if it were in person, typically how it goes is the night prior to your official interview is a social. That's where usually you'll be with, the residents, maybe like at a bar or something. So it's definitely way more casual, and you're just kind of drinking and talking to them, getting to know them, getting to know more about the program, the whole kind of vibe of the program as well. But definitely you have to still be, professional at the same time. You can't, be too unprofessional, as they're still watching your behavior and seeing how you interact with people. So just be conscious of that, and making sure, of course, your phone is off and you're maintaining eye contact. Virtual, one thing that I learned was I actually bought a ring light. I was kind of hesitant in buying it, but then like my mentor said, it really helps to, just brighten up your face, and it makes you look more lively. And definitely I feel like turning on versus turning off it, I feel like just kind of affects your presence virtually. So I feel like that would be a good investment, just having a very nice ring light. It's definitely not fun if you're interviewing, your interviewer can barely see you and it's all pixely and kind of fuzzy. So make sure your webcam's up to date as well. Making sure that any roommates, family, or pets are aware of when you're interviewing, so they don't barge in the middle of a question that can definitely be pretty awkward. And other than that, one thing that I thought was interesting too was a lot of times you will look at your screen and you'll think you're like, looking at the person virtually in the eyes, but then it may come across like you're looking to the side or something. So in order to really kind of reenact looking them in the eyes, find exactly where your webcam is. So if you have on like a MacBook, it's kind of towards the up in the center, so you kind of look right at that green dot. And also my friends, they have webcams like towards the bottom or something. So make sure you kind of look right there at the camera, like right there for me, and then kind of helps maintain that virtual eye contact. And that I thought that was something that, I wasn't really aware of before, but I feel like it definitely impacts your whole presence and the way you come across during those interviews. And this is just some information about Match. Match is something very, very new. It's different from like dental schools, where if you, let's say, get into 5 dental school, then you are in the power of choosing from those 5. But for Match, essentially how it works is, let's say you interview at 5 programs, so then you have an option of ranking those programs you're interviewed at from 1 to 5. But however, you don't have to rank all the programs, because by ranking a program, you essentially have a probability of matching there. But if you really absolutely did not like a program from interviewing there and don't want to even consider going there, you can not rank them. So maybe instead of ranking the 5 places you got interviewed at, maybe you can just rank 4 if maybe there's one program that you weren't so sure about. And then in addition to you ranking the programs, let's say in our example, ranking the 5 programs you interviewed at from 1 to 5, the programs you interviewed at also rank the candidates as well. So maybe that one program where they interviewed maybe like 100 candidates, they rank it from 1 to 100 or however much they want, and if they want to rank the applicants at all. So if there's a mutual match, then you match there, and that's where you get accepted. So it's impossible to be getting matched to multiple programs. You can only either get matched in one program or not matched at all. So it's definitely very, very stressful, and I think that was the most stress I've ever been in my life up until match day. And there's some stats shown on the Match website that definitely have a high percentage of being matched by interviewing at more schools and also ranking those schools. So it seems kind of common sense, but it's just this little stat that I found on the website. And then that's pretty much it for you guys today. And thank you for listening. And yeah, it's open for questions if you guys have any. I'm sorry, I think you might be muted.
Oh my God, I went through all of that. I'm sorry. I was just saying thank you so much, Dr. Liu, for all of that. It was such an informative presentation. And I definitely learned a lot about the residency process. It's definitely something that wasn't in my view yet at all, since I haven't been to dental school yet. But it was so interesting to learn about like what a social is, or I didn't even know that was part of the whole residency process. And then
Of course.
Yeah, it just seems like so much applying. Okay, so then just to start off with some questions at the beginning of your presentation, I found it really interesting that you were in a 3+3 programs, because like even those aren't common. I've heard of like 3+4 programs, but having a 3+3 program, did you find it in any way overwhelming, since everything was condensed into 6 years for you?
I feel like since it's all that I know, I really can't compare it to other people's experiences. But it's definitely a very fast-paced, I feel like, track.
Mm-hmm.
During a lot of the summers, I took like OChem during the summer, like a year's worth of OChem in one summer at like one of the days. That was pretty tough.
Mm-hmm.
But I feel like at a certain point, it's kind of got used to the fast pace. Mm-hmm. So I felt like doing undergrad in 3 years kind of set the precedent of finishing dental school in 3 years. So I kind of became used to, maybe having a little bit shorter summer breaks and just really working hard. But personally for me, I feel like it's been one of my dreams for such a long time that it was worth it, just saving some time and going straight to doing what I want to do.
Yeah.
For sure, yeah. It's like definitely gets some time used to going to a fast track program.
Yeah, that kind of just followed up with my next statement, where it's like, if you were looking back on it, would you have wanted to take like a gap year for yourself or an extra year somewhere along the line? Like, do you regret that in any way, or you're happy with where you are?
I would say I'm definitely happy with where I'm at, just because it's, like I said, it's been like kind of a long goal for a very long time. So I just want to, get to where I want to be a little bit sooner. But there's definitely, nothing bad about taking your time at all. And I guess it helps developing as a person, both personally and professionally. But personally for me, I don't really feel like any regrets in taking the faster route.
I totally see that. Yeah, you're definitely saving a lot of time. Yeah. And then so with just on a introspective, what it was like going to 3+3 program. Did you find it difficult to like have like a work-life balance, like even now in residency, perhaps?
Good question. I feel like definitely since things were accelerated, that I had to really fine tune my time management skills and think about what mattered to me and spending time with that. So for me, it's like really gymming was a thing that I really valued, and hanging out with friends. So like definitely at certain points I had to like turn down a lot of events and everything just because I had to study or something. But I feel like I made most of my time, and really having that time balance, as you can't be studying 24/7. That's just not healthy at all. So I feel like I make it work, especially even with the residency right now. I'm trying my best, balancing my social life and gymming and everything, also with my other responsibilities. But I feel like as we all get older, there's more responsibilities as part of learning how to manage your time wisely.
Yeah, it's life.
But yeah.
And then just going into your residency now, is residency what you expected, or is it like completely different from what images you have?
I would say it's definitely some things that I probably wouldn't expect, but more or less everything that I expected. Like I expected to be, working very hard and being exposed to, new things every single day. What's kind of funny is like, I was just kind of talking to my co-resident earlier today saying, hey, it's kind of funny how chaotic our days are. She's like, I'll just walk in and say, hey, like, how the procedure go? And like my co-resident just tell me, oh, I just got peed on or something, or like my kid bit me or whatever. And it seems like so like commonplace now. But when I kind of step aside and think, wait, that's kind of odd with how we normalize chaos. But I feel like with anything that's new, it takes time getting used to. But I feel like now it's like definitely pretty much more or less like what I signed up for, and very happy because I'm learning so much.
That's so great to hear. It definitely sounds like every day is a new thing for you.
Sure, yeah.
And then, what's something that you find really interesting in the pediatric residency right now, or something that you're particularly interested in?
I would say for me is I was always told for pediatrics, it's very medical based, but I wasn't expecting to be this heavy.
Oh.
But like even like the example I said today with treating one of my patients who's undergoing chemotherapy, you really have to like do a deep dive on their medical history and like looking at their like ANC, their absolute neutrophil count, as well as like their platelet counts and things like that, and check to see if they need any antibiotic prophylaxis, if they need that. So I feel like learning about like the medical aspect of it is something that I've been, I guess, like absorbing it all right now, and didn't really expect it to be like this heavy. But I feel like that's what's like pretty cool about for pediatrics, how it's very like medically heavy.
I didn't even realize that either. Yeah. Okay. And then do you think that kind of runs in case of like any specialty? Because like obviously they're focus based, so there would be more depth of knowledge in there. So
I feel like since dentistry is a medical field, that there would be definitely like, I guess, more specific information for different specialties. Like if you want to do endo, like endodontics, then of course I feel like you have to learn a lot more about maybe how bone heals and other aspects like that, and about like periapical pathology and maybe like dental anomalies and things like that. And of course, if you're doing OMFS, like oromaxillofacial surgery, then that's very, very medically intense, especially if you're doing like one of the MD programs as well. So I feel like each specialty will have their own like medical focus. Specific to that, like you want to do perio, you're learning about how stem cells probably and how gums regenerate, so things like that.
Yeah. Okay then. And then let's see. Do you have a favorite procedure that you like to do, or something you look forward to?
Yeah. I feel like for me, it's probably just doing like SSCs, like stainless steel crowns. I feel like just very satisfying, just getting that very satisfying pop, and then knowing for sure that that tooth is very well sealed and probably won't get any caries in the nearby future. So I just think doing crowns is pretty fun, knowing that that it's protected and it's super satisfying, just like getting that like snug fit.
Yeah, I remember seeing those in like my friends' teeth when I was super young, and I'd always be like, "Wow, they have like a silver star in their mouth." It was really cool. Okay, and then of course, like with kids, sometimes they get pretty frustrating, or they get frustrated. What's like a method that you personally have or found that worked for you when dealing with a particularly difficult patient?
That's still something that I'm still figuring out. It's a really good question. I feel like different kids require different management techniques. Like for sometimes I've learned to just talk nonsense. Like I was talking to the kid earlier today how I have like a pet unicorn at home and his name's Randy, and I feed him Skittles and things like that. And it's kind of going on and on and on. And he's listening intensely and being distracted, not knowing that I'm like literally like puncturing him with this big needle, numbing him up, and then moving to structure and like all that stuff's going on. But he's just kind of thinking in his mind, oh, there's like a unicorn named Randy and eating Skittles. So learning like distraction. But then I feel like for some kids that doesn't work, so you have to be a little more stern with them and raising your voice and using voice control and showing that you are control and you can't move around. And then other times where you have to be a little more gentle with them. So just knowing and that also stems from how they were their parents treat them. So you kind of have to get a feel for how each kid is, and then kind of also I feel like it stems from your own personality. Because I feel for some people they might be a little more serious, others might be a little bit more like quirky or something. So also has your own like personal flair to your like patient management and behavior management. So yeah,
kids can be pretty unpredictable. And then I know a lot of different fields are like trying to advance like technologically. Is there anything new that you've seen in pediatric dentistry that something that we probably never seen or something?
I would say something that's probably more new is we have something called zirconia crowns. So typically zirconia is like this material that we use typically in adult crowns. It's called like monolithic zirconia, or it can be coated or something, but it's just this material that looks very aesthetic now with our new technologies, but it's very, very strong. Typically for peds, like you were mentioning when you saw your friends, they have like little silver stars in their mouth. Parents are less attracted to the idea now. Like they want to look natural like teeth versus looking like robot-like with all the silver in their mouth. So now there's like the advent of using like the zirconia crowns. They look white, so they look more and resemble more like that of natural teeth. And so that's a new thing, and definitely requires different like preparation techniques and stuff like that. And I'm sure with like lasers, you can use it for like frenectomies if they have an involved frenum, or one thing that's very popular now is having those digital impressions, and especially with kids, they hate impressions. I was a resident, he was doing impression for one of her patients, and the kid just ended up throwing up everywhere. But so a lot of kids just hate impressions and start crying. So I feel like maybe even with the advent of digital scanning, maybe I can definitely see that being the future of peds.
Totally. Oh my God. I don't even want to imagine what that looks like. Okay. And then you mentioned mission trips, and that's something I personally wanted to do myself. It sounds something like really interesting and like eye-opening to different communities and stuff. Do you find that it's difficult in your profession for dentists to like take time to go on these mission trips or like go to outreaches?
Do you mean like working dentists or like dental students?
Yeah. Like both, I guess. Yeah.
For dental students, typically we would go during like one of our breaks, like a spring break. So we'll set aside our vacation time to go there. And I'm sure for like dentists who are like actively involved in mission trips, that either they take like time off, or they just do it during like the vacation times or something. So I definitely feel like with anything, if you're really passionate about something, I feel like it's worth sacrificing your time pursuing that.
And then what particularly makes you want to go on a mission trip?
Um, so I just feel like with like a lot of times with dentistry, sometimes the kids who need it the most don't have it at all. And then so especially when you're going to those developing countries, a lot of these kids have, never seen a toothbrush before or something like that. So they really needed dental care. So I feel like giving treatment to those kids really, helps them out and, exposes them to dental care. And I feel like it'll really benefit them. So that's why I really plan on, going on mission trips when I'm a working dentist.
Mm-hmm. Yeah, it's definitely something I would like to explore or look at.
Yeah.
And then, all right, what's something that you find particularly difficult in pediatric dentistry that maybe like no other specialty will look at or?
So when you look at pediatrics from like a technical standpoint, I'm sure there's like procedures that normally we probably won't be doing on an everyday basis. But I wouldn't say it's like very technically challenging because when you're doing fillings, the same as when you're doing class 1s and class 2s on adults. You're not really doing like crown preps with like adult patients. You're more just doing stainless steel crowns and then like pulpotomies and endos. I don't think it's very different. But what I think makes pediatrics very, very different from other specialties, of course, is knowing it's like a little person behind those teeth and dealing with their behavior and knowing that how you treat this patient and how you set the precedent for them will affect the rest of their lives. Because I've seen like some of my patients in dental school who are 75, they're these very, very sweet old grandmas and grandpas, and as soon as they're walking towards my chair, their hands are just shaking and they're just telling me how they're just traumatized as a kid. So this old grandpa is still remembering things that happened to him when they were, 5 or 6. So it really shows that, your experience as a kid really sets it up for the rest of your life. And a lot of times, sometimes these adults neglect their mouth because they're so scared of going to a dentist. So I feel like knowing you have like that responsibility is huge, especially as a pediatric dentist, knowing that you have to set this kid up for the rest of his or her life. And so just dealing with that behavior right there, and of course, knowing that with children, their physiology is different, especially with when you're administering local anesthesia. So you have to really be careful about calculating the amount of local anesthesia. Like if they're weighed like 25 kilograms, and you have to do the calculations to find what's their maximum milligrams of anesthesia, and then how many carbs you should be using just to make sure the kid's very, very safe. And also knowing how they metabolize drugs differently. So knowing how to prescribe and like the amoxicillin and things like that. So kind of having a very sound medical knowledge in that regards is what makes, I think, peds different versus like if you do endo, it's a little more challenging with doing root canals. That's very, very technically advanced.
Yeah, that's actually really funny because I'm studying like different like the developments of like dental phobias and like how to treat them, because I know it's very hard to like treat patients when they do have that phobia. So what's something that like you do to help to relax your patients, or if someone out there experiences dental phobia, is there any recommendations that you have for them?
So there's pharmacologic and non-pharmacologic ways of treating that. So in terms of pharmacologic, that's like using different drugs such as nitrous oxide or like Versed and morphine, or even using general anesthesia where they're completely knocked out and sleeping. So that's one way to calm them down with pharmacologics. But non-pharmacologic, that's when behavior management comes to play. So that's again kind of depends on your own personal style. So I feel like at the very core of it, it's really establishing trust in your patient, because you're at the end of the day this complete stranger who's doing like this very like invasive thing, like sitting down flat on your back and opening your mouth is something that's like feels very vulnerable and kind of weird to think about it. So let alone having this little kid just trust this complete stranger, putting sharp objects in their mouth and things taste weird. So you really have to develop that trust. So the way in which you proceed in developing that trust, varies on each provider, each dentist. But I feel like at the very base of it, that's one way to handle, different, like, I guess, like with behavior and developing the trust and preventing dental phobia. Like one thing I'll do is maybe, like telling a joke or making the kid laugh. Like personally for me, I feel like that kind of breaks the barrier that, you're relatable and sociable and you're not so scary.
Yeah. All right. Keep that in mind. And then, let's see. For your residency, you did it through the match program where you matched with a school, and that's how you got up there. Yeah. Okay. So then, overall, you said that you did around 10 to 20. You tried to apply to 10 to 20 different programs.
Mm-hmm.
So, if I understood correctly, you would need to apply to a bunch of these schools, but you could just choose to match with some of these. And if you do happen to match with them, that's the school that you would have to go to.
Yeah, so you would rank the schools that you interviewed at, because then like the schools will be able to like match you. So like if you were to rank a school you didn't interview at, like there wouldn't be any possibility of you matching there. So you would definitely just rank the schools that you want to go to and that you interviewed at, and just create that ranking list of like one being the place that you want to go to the most, and then the last one means you still would be happy going there, but maybe you would prefer going to the other schools on top of that list, higher ranked. So it's kind of confusing just because it's something that we really never dealt with, but it's just like this system that they have set up.
I see. And then your residency is 3 years? I forget the range that pediatric residency runs in.
So typically I'll say for the great majority, a pediatric residency is 2 years. There's some 3-year programs out there. I think University of North Carolina, UCSF, they have programs there. But other specialties, I'll say like perio, endo, they have around a 3-year residency. And then of course, like the people over doing oral surgery are pretty crazy. They have like 4 or 6 years. So guys would for a long, long time.
Mm-hmm. And then did you have any plans for what you're going to do after residency? Like, do you think you're going to open your own practice or do corporate dentistry in pediatrics?
Yeah, my plans to most likely fly back to California is because that's where my family is, and then just start working in California, and definitely feel like private practice for a couple of years, and then eventually open my own practice. That would be a goal.
And then this is just a fun question for everyone here and for me. What do you think you would have done if it wasn't pediatrics? Like, was there another specialty that particularly interested you, or what was your number 2?
Other dental specialty? I feel like probably not ortho, not perio, not oral surgery, probably endo. So I feel like endo or being endodontics, that's where you do root canal procedures. For the root canals they did in dental school, I felt like I had a lot of fun in it and I had really good mentors in that department. And just felt like it's a specialty where you have to be very, very precise, as a couple of millimeters, even like 0.5 millimeters off can mean the difference between, it being a bad root canal versus a good root canal. So being very, very precise, and I always felt like I kind of gravitated towards doing things that are very precise. So I feel like I'll have fun doing endo. So yeah, good question.
And then just to go all the way back again, what was one of your favorite parts about both undergrad and dental school, since you smushed it all together?
Parts about undergrad dental school. I'll say definitely like along the whole journey, I feel like I've made like lifelong friends that, I feel like have my back. Like no matter what the situation is, just because you're working so hard, you form like such like close bonds because you're like in the trenches with them and you're stressing out, working, you're both like crying together and celebrating together. I feel like that really like strengthens those like lifelong bonds and people that you'll be friends with forever. So I feel like that was like definitely a very big highlight of both undergrad and dental school.
And then just out of my own curiosity with your program, was it 3 years at the undergrad college and then 3 years at the dental school, or it was kind of like a mixed program that overlapped the classes? Or
Yeah, so we do 3 years of undergrad, and that's in the undergraduate campus in Stockton, California. And then our dental school is located in San Francisco. And then so we do all of our dental school training at the dental school in San Francisco. So like different training, like different campuses. So we would.
And then I was going to say, I'm guessing that since you were in the 3+3, you probably went to school with all of your friends for all those 6 years or something along those lines.
That's what's cool. It's like a lot of my buddies, like from like, we took like, you know, AP Bio together and then walking around in our little lab coats or in like doing Gen Chem, trying to figure out how to do all this stuff. And then just a couple of years and we're walking across the stage and we're being announced as, you know, doctor behind our name. So I think that's a very cool experience, you know, being from like, you know, from day zero all the way up until graduation dental school and kind of seeing that, you know, change. I think that was really cool of kind of with those friends.
Definitely something I'm jealous of. Okay. And then, let's see. Well, I have so many questions. Just trying to find an interesting one. And then,
questions.
Did you find any like differences, transitional differences from dental school and residency that like was a little difficult to adjust, or it was kind of the same grind all over again?
I would say it's a different grind. For dental school, from undergrad to dental school, personally for me, the transition was the aspect of hand skills. It's something that, you know, I was never used to. In the beginning of dental school, I just remember I'll like show one of my faculties at prep, it's like, oh yeah, your thing's off by 0.2 millimeters. And I'm like, how do you even see 0.2 millimeters? And now I'm like slowly beginning to understand that you kind of develop an eye for it. But in the beginning, just boggled my mind. I'm like, how are you possibly like able to like determine that? Like, why are you so picky or something? And just learning how to use a handpiece, that was a really big learning curve. Like dental school, that's a big learning curve and jump, just like the clinical aspect of it. And on top of, you know, having your didactics as well. But in terms of for dental school to residency, I'll say typically in dental school, I'll treat like 3 patients on a really good day, very busy day. But then in residency, it's around like 12 to 15. So that's a big jump. But then of course, when you go in private practice, it's even like a way bigger jump too. So I feel like with every step that you go to, there's like this adjustment period that you know, deal with. But I feel like it only just, you know, makes you stronger. I mean, of course, you'll feel overwhelmed in the beginning. It's kind of getting over that and kind of learning how to deal with it and taking it, you know, step by step really helps. But I feel like for residency, it's learning how to personally treat like a lot more patients and dealing with that workload. But also for me, for the first couple of, even now too, definitely for now, just doing new procedures like, oh, I've never done like a lower lingual holding arch before, or oh, I never done a pulpotomy before. It's kind of doing new things every single day. That's definitely like adjustment period.
Do you feel like you experience any like physical or mental burnout a lot anymore, or?
I would say for me, definitely there are times where, probably even like dental school, where you feel kind of like the imposter syndrome. That's where you feel like, oh wow, all my classmates are so smart and accomplished, but I really don't feel like I belong. I feel like that's something that a lot of students feel in dental school. It's completely normal that you feel that way. So I just feel like knowing that feeling's going to come eventually is, you know, helps you kind of mentally prepare for things like that. But also, just like I said, having really good like extracurricular activities. So whether it be hanging out with friends or going to the gym or something, I feel like that personally helps with, you know, any sort of burnout. As you know, it's definitely rewarding to study hard, but you can't be a robot and study 24/7.
Yeah. And I think that's all the questions that we have for tonight.
Yeah.
It was absolutely wonderful listening to your presentation and learning about pediatrics and everything that you have said about the application process. Definitely new for me, and I'm sure it's new for everyone out there watching too. And yeah, it was great to listen to you, Dr. Liu, and we hope to see you again in the future.
Hopefully that was helpful. Thank you so much.
Have a good night.